BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
Hi, this is Devin Lockett, the president of JobSite Route. As the son of a general contractor, I know how difficult it can be to get good food on the job site. And letting your construction workers leave the job site to buy lunch just takes valuable time away from them being on the site. I've developed an app and a program that will bring a steady stream of food trucks to your job sites every month for the low price of only $100 per month per site. That comes up to about $3 per day to have a steady stream of food trucks coming to your job sites all day, every working day. You can also contact the food trucks ahead of time and pre-order your food from the menu on our app. This saves valuable time for your construction workers and for you. It also sends a variety of delicious food served on Southern California food trucks to your job sites all day. When you think about it, it only makes sense to join the JobSite Route Network. Joining me. A happy Monday. Hope you guys had a great weekend like I did. My son and I went and enjoyed a nice vacation. And I'm going to be sharing videos about our vacation on the Devin Lockett channels. So I want you guys to stay tuned for that. And also you can visit the Kai Lockett channel, my son's channel, youtube.com/Kai Lockett, and see his footage covering the vacation that we enjoyed out in Colorado and Arizona. We went to Mesa Verde in Colorado and got a chance to visit the ruins of the ancient native civilization that strangely disappeared many, many years ago, as well as the Grand Canyon. And if you haven't seen the Grand Canyon in person, it is something that you definitely have to see. You cannot let your life go by without viewing the Grand Canyon. I just want to say that. Bear with me, people. I'm just opening up a few things here. All right, so what I'm going to do now is we're going to talk about the subject of the day. The subject of the day is biomagnetic pair therapy for addiction. So here I am at the BiomedRx Health Center, as you know, on Route 66 down here in Upland, California at 751 West Foothill Boulevard in Upland, California. And we do a lot of different therapies. We do high-tech holistic health therapy, including neurofeedback, brain training, right? Audio-visual brain entrainment, cranial electrotherapy stimulation. These brain treatment therapies are very good for addressing addiction. But what I'm going to deal with right now, what I'm going to talk about right now is treating addiction using magnets only, using biomagnetic pair therapy. Now, everyone's addiction, everyone who has an addiction is unique. Everyone's brain is unique. And of course, you're going to find that you need to take different approaches to treat different people. That's going to be the same no matter who you're dealing with and no matter what the condition is that you're trying to address. So I'm only going to give you some loose guidelines that you can go by when you're treating people who are suffering from addiction. When I say addiction, I also mean alcoholism as well. So, without further ado, let's see if we can move on into the next slide here, and I can show you guys a little bit of what I am talking about. Okay, so let's go to the show slide so I can show you what I'm talking about here, okay? All right, now if you look here, I call this my PDR, my physician's desk reference, right? If you look here at my PDR, there's really only one pair for adicciones, all right? And that is borde de cuerpo caloso, borde de cuerpo caloso. So these are right back here on the parietal lobe. Why are we addressing the parietal lobe? Well, this is something that I get really kind of sensitive about because it involves a lot of crossover between the therapies that I do for the brain, neurofeedback and cranial electrotherapy stimulation and audiovisual brain entrainment, with the with biomagnetic pair therapy. Most of us, during the vicissitudes of life, accumulate slight little kinks, or what we might call dysregulation, neocortical dysregulation, or dysregulation of the neocortex. The neocortex is that part of the brain
that you see on the outside when you look at the brain, right? It's the wrinkly part of the brain. The neocortex is divided into several lobes: the frontal lobe, the temporal lobes, the parietal lobe, and the occipital lobe. Okay, the parietal lobe is a common area where we accumulate dysregulation in normal everyday life through normal everyday stress, right? The intensity of emotions that come with arguments and conflicts, worrying about things, boredom, which is just ADHD, the dysregulation that accumulates in the neocortex as a result of normal emotional ups and downs usually occurs right here, mainly in the parietal lobe, somewhat in the temporal lobes, but mainly in the back forehead, I guess you could say, the top back of the head, the parietal lobe. And in that area, we need to relax, especially on the non-dominant hemisphere of the brain. We need to relax that area on the right side of the brain, especially in order to get rid of that gnawing feeling that makes you want to consume a drug or consume alcohol or consume something to help get rid of the effects of dysregulation. The dysregulation in the neocortex makes it almost impossible for your brain to reach an alpha state. When I say alpha, I mean basically calm and relaxed, yet still awake. This is where most of us want to be most of the time. When you are heavily dysregulated, you have to reach for a beer or a glass of wine or a joint in order to reach an alpha state more easily. You're not going to reach an alpha state with all alcohol, and you're not going to reach an alpha state with all drugs. But marijuana, those specific ones, and beer and wine, those specific alcohol types of alcohol, do assist you in reaching the desired state of relaxation. Now, of course, these substances also cause further dysregulation of the neocortex, and they create a dependency so that you have to therefore turn around and continue to use it in order to reach that comfortable state. That is the essence of what we call addiction. But to help a person free themselves from addiction, you have to take a multifaceted approach that is going to be unique for every person that you deal with. So as you can see, there's only one pair that is being suggested here by the physician's desk reference and for addiction, and that is right across the parietal lobe, okay, negative and positive. Now I'm going to show you some more pairs that I use for addiction, because addiction is a multifaceted phenomenon, right? It's not just the brain. Yes, that's right. Go ahead and hit the like and for notifications and all of that. Hit the subscribe. When it comes to freeing a person of addiction, first you have to find out what they are addicted to. Is it a chemical addiction? Are they addicted to a particular drug? Or is it a behavioral addiction? Are they a codependent who's addicted to unhealthy relationships? Are they addicted to habits like reading or writing or bodybuilding or something constructive and positive? Or do they have negative addictions that are going to be destructive to them? Most of the time, addiction involves chemicals because it involves some substance that a person is ingesting on a regular basis in order to reach that alpha state in their neocortex, in order to relax, in order to get right, as they say. So what we're going to do right now is we're going to use, once again, our famous model, Kai Lockett, and I'm going to illustrate some basic locations that you use in order to address addiction. Bear with me. Head. I'm going to stick with the head. I want to show you a very important pair, and that is negative and positive both on the right temporal lobe. Okay?
the right templar lobe. Remember, the heart is on the left-hand side of the body, and therefore the left side of your brain is bigger than the right side of your brain. I know that sounds crazy, right? The left hemisphere of the brain is bigger than the right hemisphere of the brain. That's your dominant hemisphere. And therefore, because it receives more blood circulation. So the left hemisphere is going to be larger. So the right hemisphere is going to be the repository for a lot of negative emotion. A lot of people who are criminals, or what we call criminally insane, we get a lot of success by treating them on the right templar lobe. Okay, now that we've got the head done, right, because that is a very important part of addiction, I'm going to remember to always use a unipolar, very powerful negative magnet directly on the navel in order to release stem cells. The navel, your navel, is your end of the umbilical cord. So when you were gestating in your mother's womb inside the placenta, the navel is where you received all of your nutrients. So by using a unipolar negative magnet here on the navel, it's going to slowly release stem cells throughout the. Also, if you're dealing with an addict, a person who has a chemical addiction, a physical addiction, a drug addiction, or an alcohol addiction especially, then you're dealing with someone whose liver has been severely taxed. So I have to break out the big boys, right? The most powerful magnets that I have when I'm dealing with addiction, and the liver, because this is the largest part of the body. Now, you can treat the liver on this one side here, or you can treat it across the diaphragm the way I'm doing right now. The negative here, the negative pole here, on the belly, the large part of the liver, and then the positive clear on the other side of the diaphragm, bladder to bladder, and the most important, or some of the most important, are the kidneys, with the positive pole of a magnet on the superior side to excite the adrenal glands, while the negative pole is on the body of the kidney itself, or actually on the bundle of nerves that is lateral to the kidneys, that actually controls the kidneys. Okay? Positive to the adrenal glands, negative right on the kidney area. Okay? How you feel? Good. Good, good. And of course, if there is severe smoking, then there actually is some lung damage, then you want to put magnets right under the lungs, negative on the left and positive on the right, facing the client. So that's pretty much it as far as the pairs that we're going to address right now with addiction. Like I told you before, dealing with addiction is very unique to the client, to each patient. Each patient is different, and you're going to find that there are different pairs that you're going to use depending on what other pathogens the client might be burdened with, and depending on what their drug of choice is or what they're actually addicted to. So we're going to have to get a little bit more specific into that in future videos. But right now, I just want to show you the basic pairs to help calm a person down, address the neocortical dysregulation, and to detoxify the body in the areas that may have gotten intoxicated as a result of the person suffering from their addiction. All right.
been suffering from a little bit of piriforms lately, so it's literally a pain in my ass going on right now. But I'm gonna just do my yoga stretches and deal with that on my own. But as you know, once the magnets have been put in place, you leave them on for about a half hour to 35 minutes. Now I'm here in Southern California. If I were in Mexico, closer to the equator, or even worse in Ecuador, then I could probably leave the magnets on for a shorter amount of time, because of the strength of the magnetic field of the Earth being stronger closer to the equator and weaker farther from the equator. And of course, that is due to the increased movement of the metals and molten lava beneath the surface crust of the Earth, right? So at this distance from the equator, I would leave them on for 25 to 35 minutes. I tend to leave them on for 35 minutes. Now, I have to caution you, as always, if you're going to have biomagnetic pair therapy, you must be well hydrated before and especially after treating yourself with magnets, okay? Magnets work very well, but what they do is make you very thirsty and dehydrated. So if you don't drink a lot of water before your treatment, and you're the practitioner, the person doing the therapy to you, must also drink a lot of water and be very well hydrated in order for this process to work on either of you. But if you go ahead, drink a lot of water, do your biomagnetic pair therapy, leave the magnets in place for at least a half an hour, turn around and drink more water in the afternoon of that same day than you would normally drink, then you're going to be fine. Okay, then you're going to be fine. If not, you may feel worse than if you hadn't messed with magnets. So I'm just trying to give you the precautions, because most practitioners say I'm giving away the keys to the castle, and I shouldn't even be telling you guys this. But I believe that everyone should learn how to heal themselves in the least expensive way possible and in the most holistic and natural way possible. Magnets are cheap, especially if you consider the fact that once you own the magnets, you're going to use them over and over again, and they never lose their power, okay? And everyone should know where to place the magnets to heal themselves and members of their family of 99.9% of the pathogenic illnesses that one could get. So if you keep watching this channel, if you subscribe, if you support us on Cash App, if you appreciate what I'm doing here, then please drop us some money on Cash App, $BiomedRx, okay? And I will be monetized on this channel very soon. But in the meantime, go ahead on and support us. You can join us on Patreon. You can join us on Cash App. You can support us on Cash App. Lots of things that you can do, right? Lots of things. Don't let that money burn a hole in your pocket. But once again, thanks for watching me. I want everyone to stay kind, because as you know, kind is not only the new sexy, kind is the only sexy, damn it. Stay blessed, stay blessed, all right? And remember that God loves you, and stay healthy. If you have anything that you would like me to address, any illnesses that you would like me to address, say so in the comments below. And if you have any products that you would like me to demo, contact me on the information that will be scrolling during the ending message of this video. All right? Stay kind, stay blessed, stay healthy. Peace.
Gold label quality BiomedRx CBD oil is made from organic hemp that is locally grown, glyphosate-free, gluten-free, non-GMO, homogenized, third-party tested, and CO2 extracted. Visit www.biomedrxcbd.com.
BiomedRx Optimum Woman is the only woman's high-potency full-spectrum multiple vitamin supplement to contain 56 nutrients, including those most important for today's woman, such as calcium for bone health, iron for healthy red blood cells, beta-carotene, biotin for nail and hair health, gamma-linoleic acid from evening primrose oil, octasanol, grapeseed extract, a potent antioxidant important for maintaining capillary strength, and vegetarian digestive enzymes. Visit www.biomedrxsupplements.com.